Bismillahirrahmanirrahim. So this is the second part of ECG. So in this part, I'm gonna show you how to calculate the heart rate, right? So first we'll have to look at the rhythm. So if rhythm is regular, so calculation of the heart rate is different, and if rhythm is irregular, so we'll have the different method of calculation for that. So how to calculate the heart rate, right? So let me show you how to calculate the heart rate if rhythm is regular, right? So okay, so let me draw the complexes here. So this is P wave, then we'll have the PS in interval, then we'll have the QRS complex, ST segment, then T wave, right? Then we'll again have P wave, then PR segment, then QRS complex, ST segment, and T wave, like that. Okay. So if rhythm is regular, so we just need to calculate the number of big scales between two R waves. So this is R wave and this is R wave. So we're gonna calculate the number of big scales. Like here, if we calculate the number of big scales, so 1, 2, 3, 4, and 5, right? So 5.5, 4.5, right? So we need to divide the number of big scales by 300, right? So we have 300 divided by number of big scales. So we have just say these are the 5 big scales. So if we calculate the if we divide it with the 5, so we will get the rate of 60 beats per minute, right? So this is how we're gonna calculate if rhythm is regular. If rhythm is irregular, so calculation rate is different, right? So how we're gonna calculate that? So just say we have the one QRS complex here, right? And this is T wave, then we'll have the again there's another QRS complex, right? And then we'll have the P wave, then we'll have just like that, right? Okay, and then we'll have okay. So it's just like that. If we calculate the rate here, it will be different. If we calculate the rate here, it will be different, right? So how we're gonna proceed it further? Okay, let me show you how we're gonna go for that. If rhythm is irregular like that of an atrial fibrillation, so how we're gonna calculate the heart rate? So what we need to do, we have to calculate 30 big scales in the rhythm strip, right? Rhythm strip will be on the bottom of an ECG, so it is usually lead to that we take it as rhythm strip. So we're gonna calculate 30 big scales. Just say 30 big scales are up to this, right? So 30 big scales, just say 30 big scales are up to this, right? What I have marked here. So between, if we calculate the, just say these are the complexes, right? So these are the QRS complexes, just like that. So okay, okay, okay. What we need to do, we have to first we have to calculate 30 big scales, right? And then we have to calculate, second step is calculate number of R waves, right? And the third step is multiply the number of R wave we calculated in step 2 with 10, and that's how we're gonna get the heart rate in irregular rhythm, right? So just let's calculate that. So we calculate the number of R waves. Just say these are the 30 big scales, right? So 1, 2, 3, and just like so on, right? So we have first R wave, second, third, 4, 5, 6, 7, and 8. So 8 we have calculated the number of R waves. These are equal to 8. So if we multiply 8 with 10, we can get the rate. So rate is 80 beats per minute, right? So why it is so? So in 6 second strip we have 30 big scales, and we can get the number of hours we can, right? If we multiply 6 with that of 10 is equal to 1 minute, right? 60 seconds or 1 minute. If we multiply the 30, we can get the 300 big squares. And if we multiply the always, what we get here, these are 8. If we multiply with that of 10, we can get the heart rate 80 beats per minute, right? So that's how we're gonna calculate that. So so if we let me show you again here that this is P wave, then we have PR segment, then we'll have the QRS complex, then we have T wave, then again we'll have the P wave, and that's how we're gonna proceed further, right? So we have to calculate the rate between two R waves. So basically we are calculating ventricular rate, right? So if we calculate in this condition, so between two R waves we have 1, 2, 3 and 4 and 5 big squares here, right? So rate will be like 300 divided by 5, we'll have the 60 beats per minute, right? So this is ventricular rate, and it should be equal to that of atrial rate. So normally ventricular rate is equal to atrial rate, right? So atrial rate is equal to ventricular rate. So again, if we calculate from atrial rate, so we will have to calculate between two P waves, right? So if we have to calculate atrial rate between two P waves, so again if we check the number of big scales, so 1, 2, 3, 4 and 5, right? So again it is so atrial rate is calculated between two P waves, right? So it is again 5, so we're gonna divide 300 by 5, so we'll have the 60 beats per minute. So condition in which atrial rate is not equal to ventricular rate. So can you name any condition? So we can see that, let me draw another ECG here. So just say this is P wave, another P wave, we have another P wave, then we have the QRS complex, then we have the another P wave, and QRS complex is far away from here. Just let me draw it here. Okay, so P wave, we have the QRS complex. If we check atrial rate here, so it is almost, if we divide, it is almost less than 1 big scale, so it is almost 300 beats per minute. If we check the ventricular rate, so it is much more. So here atrial rate is not equal to ventricular rate. So this is basically, I'm talking about third degree heart block, also known as Stokes-Adams syndrome, right? So third degree heart block, so atria contract, the pacemaker for atria is SA node, while pacemaker for ventricular rate is bundle of his, right? So there's complete AV nodal dysfunction, right? So in that condition atrial rate is not equal to ventricular rates. So that's all about the heart rate. In the next video I'm going to talk about axis. So we have various methods of calculation of axis. I'm going to talk about the one is simple method, that is thumb method, and then there is another bit accurate method that is called isoelectric method. So I'm going to talk about both of those in next video. So that's all for today.